Hello friends, I welcome all you to this Pharma family again. Today we are going to focus on a topic of amnesia. In this video, we are just correlating with amnesia with some of other Telugu movies, which denotes the different types of memory loss. First, we just want to know what is amnesia. Amnesia, which is generally called as memory loss, and the people who are having amnesia will have difficulty in memorizing their memories, and others they can't recall even the facts and some of the past experiences in their life. The people who are suffering with amnesia usually retain their knowledge of their own identity as well as motor skills even, and this mild memory loss is a normal part of aging. Upon increasing the age, the memory loss is a normal factor to be come in consideration, but this significant memory loss or the loss of inability to form the due to new memories may indicate the presence of an amniotic disorder. We just want to go different types of amnesia. The first one is anterograde amnesia. When you have anterograde amnesia, you can't form any new memories, and this will affect the temporary and the things that happened in their past, and the information which is stored already in the mind. That means short term memory, we can say, is that all these will get disappear, and the patients with this can remember data even which happened before the injury. If the person is having injury at that time, upon that, before the considerations before the injury, all will he will get remember, but after that he is unable to recall any of the present memories, and he'll easily forget that, and it is called a short term memory. And this type of amnesia is called anterograde amnesia. Here we can see this type of amnesia in the movie of Gajani, where he'll forget everything in their past, in the present culture, and before the injury what he is having, everything he'll remind, but after the injury he'll even forget within a memory, within a span of minutes even. That is seen in this Gajani movie. That is called as anterograde amnesia. And the second one is retrograde amnesia. When you are having this retrograde amnesia, you'll lose the existing previously made memories, and this type of amnesia will tend even to affect the recently formed memories first, and older memories such as memories from childhood and the from the past histories are usually affected more slowly sometimes, and diseases such as dementia will cause gradual retrograde amnesia. I mean past, from the event before the past, it is called as retrograde amnesia, and the event to present the person will forget is called as anterograde amnesia. This retrograde amnesia is seen in the movie of Usaravalli, where the person will forget the past memories in a span of time. That is called as retrograde amnesia. And the other one is transient global amnesia. This temporary loss of memory, and it is very hard to form new memories, and it is a severe form of anterograde amnesia. It is a rare form of amnesia that when compared to other types of amnesia. And the other one is traumatic amnesia. The memory loss will be caused by hard blow of an head. People who lose their memory as a result of a car accident, that may be as a traumatic amnesia, that may be injury to the brain. This amnesia will depend on the severity of this injury. And the other type of psychosis of, different types of amnesia, these all comes under the typings of amnesia. That is Wernicke Korsakoff for psychosis. It is a type of memory loss which is caused by extended use of alcohol abuse, and it is gradually worse and worse over time, and he'll totally depend on the intake of alcohol. And this type of memory loss is called as Wernicke Korsakoff's psychosis. And the other type of amnesia is historical amnesia. This is very type of amnesia. The patients who forget not only their past but their identity even. And the other one is infantile amnesia. The patients cannot recall the events that are occurred in their childhood memories. And the post hypnotic amnesia, events that during the hypnosis cannot be recalled. And the source amnesia, the person can remember certain information, but he doesn't know how and where they got this information. They'll know that information, but how it got, they are unable to recall those. We can focus on anterograde amnesia, and the other one is retrograde amnesia, and sometimes the post hypnotic amnesia, and the other one is historical amnesia. These are the different types of amnesias, and the symptoms majorly include they having the false memories, that is completely inverted with the real memories, and they'll forget the memories which are happened real, and they'll go with the false memories. It is called as a confabulation. This uncoordinated moments and tremors can indicate this neurological problem. The confusion will be there, disorientation, and some of short term memory. And some members will have the total loss of memory even. The person will unable to recognize the faces or sometimes even locations, everything. Their ability to learn new information is impaired in this anterograde amnesia even. The ability to remember the past events and the previously familiar information is also impaired in retrograde amnesia. The causes may be either there will be like only the amnesia causes, that is psychological disturbances is the major cause of getting this amnesia. How can this amnesia will be diagnosed mean? A doctor will rule out by asking his causes of memory loss, and including like dementia, alzheimer's disease, and sometimes depression, or or patient is having a brain tumor, everything. They'll take the entire medical history and they'll ask the questionnaires to the patient, so that by talking to the doctor we can conclude the which type of amnesia the patient is suffering with. What are the some of the questions that are need to be asked by a doctor is, can the patient remember the recent events which are occurred in his past or in future? When did this memory problem starts, and how they did develop, and what factors are confounding this memory loss? Is there any family history of this neurological or psychiatric conditions? Is the person consuming any alcohol, or he's using any medications? Is having any intake of any illegal drugs, or whether he's having any carcinoma history, or the patient is having any history of depression or seizures? All these type of questions will be asked by a physician to diagnose this type of amnesia. A physical examination is also be done, which by measuring the reflexes, that is sensory functions, even the balance and the control of different terms will be assessed by undergoing these physical examinations. And some of the treatment is they'll resolve itself. Resolution is itself is a treatment. There is no particular drug to be taken to the patients. Psychotherapy is given to some of the patients, and hypnosis is one of the major treatment procedure that can be done to recall their memories, and the family support is very crucial in these patients. Based on this family support only, the resolving tendency is very more. Working with an occupational therapist to acquire new information and to replace their lost informations and lost memories, or your use of these existing memories. A basic acquiring of new information will be considered as a treatment. Some of them will use it to have the digital assets and smartphones as the daily reminders to be kept, and two important events should be captured in their mobiles and smartphones. Medications, when to take the medications, so that is nothing more medications to be taken by the amnesia patients, just as a supportive care the patient is given with some of the depressive antidepressants, and sometimes contact lists of every photographs, where they are going to forget any of the faces, they are going to remind with these photographs. And currently there are currently no drugs for this restoring memory lost due to amnesia. The malnutrition or working Carcinoff syndrome can involve the memory loss that is occurred due to loss of the thiamine, that is vitamin B1 deficiency. So targeted nutrition will help in resolving this condition. Some of the foods that can improve the type of amnesia conditions is a whole grain intake, whole grain cereals and legumes, that is beans and lentils and nuts and lean pork, and these are some of the rich sources of thiamine where we can resolve the Korsakoff syndrome. These are some of the fats. And I think in this video we just can differentiate what are the different types of amnesia and how can it be diagnosed, and what are the symptoms, and what the treatment therapies we are going to take as a pharmacological or a non-pharmacological treatment for the conditions of amnesia. This video may help you a lot, and please like, subscribe the channel Pharma Family to get more updates regarding the medical conditions. And thank you.